Welcome to Therapist Starter Pack, a podcast for those who are just getting started in the field of mental health therapy. I'm Autumn, and I'll be your host today. Today we'll be discussing therapeutic modalities, what they are, how to learn them, and deciding which ones work for you. Stay tuned. As Dr. Joel Young put it on Psychology Today, the treatment approach your therapist uses is sometimes referred to as a therapeutic modality. Some examples include the classics: cognitive behavioral therapy, psychodynamic therapy, dialectical behavioral therapy, acceptance and commitment therapy, and narrative therapy. Some others you might have heard of include solutions-focused brief therapy, art therapy, play therapy, mindfulness-based cognitive therapy, eye movement desensitization and reprocessing therapy, or EMDR, emotionally focused therapy, and internal family systems. You can also see an exhausting, but still not exhaustive, list of modalities at Psychology Today. Link in the show notes and on our website, therapiststarterpack.net. Now I want you to take a guess at how many modalities are listed on Psychology Today. Go ahead, I'll wait. 70. With so many modalities, how do you know which ones to use? Well, the short answer is the ones you know that you think would help the client. So how do you learn a modality? There are many ways to learn. You might cover them in school, read up on it in books, take a formal training in person or online. You might use trusted online resources like videos, role plays, handouts, or articles. Modalities range in difficulty to master and also in their level of risk. Ideally, you want to be trained both broadly speaking about the philosophy of the modality and also on specific interventions before dropping it into a session, because you want to know what you're doing, but you also want to know why. With higher risk or more complex treatments, EMDR comes to mind, you will likely need formal training to ethically practice it. And some modalities also require specifically credentialed programs to be able to list it on public profiles like Psychology Today. When in doubt, reach out to your supervisor about whether you're ready to use a modality or not in practice. As you learn a modality, the training materials should mention when both a given intervention or the theory behind the modality itself would be useful. It can also be helpful to look at the history of what the therapy has been used for in the past. Additionally, the Society of Clinical Psychology has a website that lists suitable research-supported treatment modalities by diagnosis, symptoms, and alphabetical order. Again, that'll be in the show notes and on our website. Depending on your theoretical framework, you might use a single modality or a small cluster of modalities or integrate many different practices into one. There are at least as many kinds of therapy as there are therapists. Now, it's unhelpful but true that you have to kind of figure out what works for you through trial and error. It's kind of like when you're a kid and everyone says, be yourself, and you have no idea what that means because how do you know who you are so that you can be it? And you know it's a totally fair criticism, but what else can you really do because every person has to figure out who they are and you don't come with an instruction manual, unfortunately. I studied at least half a dozen modalities before finding one that fit my style, the way I think, and that felt good for me to use. Now, I will give you some tips. Educate yourself widely to see what's out there. Read or watch synopses like Psychology Today or Sociology of Clinical Psychology, or hear on this podcast soon to see what you'd like to focus on. Then, try multiple sources before knocking a modality. Study different formats. You can look at books, trainings, videos, articles, podcasts, role plays, or even shadowing a session at your placement. Also, make sure you take advantage of free resources, especially school libraries, and if you look on their website, sometimes they have some really good databases of videos that you can watch for free. So make sure you take a look at that or call your friendly librarian and figure out how you can take advantage of all these different tools that are at your disposal. Okay, another tip. Study how you study best. You know yourself the best, so you know whether you should be focusing on one modality at a time or bouncing back and forth between a couple different ones according to which ones you're interested in or using at the time. You know you. Study how you study best, not how other people study. Okay, I also recommend taking notes. This is especially good if you can put them in a digital searchable format, like with Google Drive or Notion. I'm not sponsored, by the way. I just think it's a cool program. Because if you can make your notes searchable, it's going to make it so much easier to find things when you need them. My final tip, practice. One of the best things I did in college was have a group of people to role play with. Now I know what you're thinking. I already do role plays for class. And that's fair. But here's the thing. When you do it on your own initiative, it's very different. Because you have more freedom to choose how you're going to navigate the roleplay session and less pressure to do it for a grade. You can use whatever modality you want, you can practice whatever intervention you want without having to fill certain requirements, and there's no teacher watching you. It's just you and another student, maybe some others supervising so they can be able to offer you some feedback. And I really encourage you to try this at least once and just see how it feels. It's not for everybody, but I think a lot of people will benefit from it who wouldn't think that they would. If you really want to take it up a notch, you can record yourself while you do these sessions and play it back for yourself. Now, is that going to be comfortable for you? Probably not the first few times. But there's a reason people do it, and it's because you're able to see a lot of really good information about how you do things. I know it's hard. Trust me, I've had to do it. It's not easy. It's uncomfortable. But it's an incredible way to grow. And that's all I'll say about that. Okay, so let's wrap it up. Therapeutic modalities are approaches that a therapist takes. There are tons of them out there, and they require different levels of formality and training. I recommend you study many different modalities and see which ones make sense to you and feel good doing. Finding yourself as a therapist takes time. Nobody else can tell you who you are as a therapist, and honestly, the truth is, being a therapist means continually learning what it means to be a therapist. As Mr. Rogers once said, are you discovering the truth about you? It's what we do as we keep on growing in life. I'm still discovering the truth about me. And that's all for today. All sources will be in the show notes and at therapiststarterpack.net. You can also find links there to subscribe to the show and leave a review on Apple Podcasts, which would be a huge help to the show. Until next time, remember, everybody starts somewhere.